What supplements help with pain? Hi, it's Dr. Ruth, the Pain Doc, founder of Chronic Pain Rescue, a telehealth practice devoted to helping those who suffer from chronic pain using holistic and integrative approaches to become pain-free or significantly painless. It is possible. Just want to share, I know there are people that are interested in supplements. Maybe you're tired of having to take medications, or you really don't want to have to take medications, but you do want something natural. So I'm presenting a list that are supplements that you may consider trying. I just want to say before we even discuss any supplement, to make sure that the supplement that you purchase, that there is a stamp, a label letting you know that a third party has tested it. And the reason for that is, unfortunately, many times supplement makers will have ingredients that they did not even list on the list of ingredients. There can be toxins, pesticides in them. Sometimes they are diluted with things that may be harmful to you. So it's important that you know that it has been verified by an outside, non-connected with the company, and has verified that it is what it says it is, that it is safe to take, that it will be effective, at least it will have the potential to be effective because it has actually the ingredients that it says it has on the label. Two agencies that you would look for the seal would be the U.S. Pharmacopoeia, which will be USP, or the National Sanitation Foundation, NSF. Those would be two labels that you would look for on the supplement you're purchasing. Another organization, however, that does do third-party testing, you sign up for a yearly membership, would be ConsumerLab. ConsumerLab.com. It's really great in terms of going through all the different supplements, whether they have contaminants or pesticides, whether they actually have what they say they have in the ingredients, whether it's efficacious, what the costs are. They can look at comparison costs. So that's also another third-party tester that you may want to subscribe to. So most of the supplements that I'm sharing are anti-inflammatories, but there are some different ones. And the big one I have a lot on because there's so many abundance of studies on its efficaciousness, how great it is as an anti-inflammatory, is turmeric. Turmeric is in the ginger family. If you know it from India, they'll be in curries and things like that. And the main active substance in turmeric is curcumin. So curcumin offers the following benefit, to name a few. Reduced inflammation. Chronic inflammation is associated with many diseases, and studies show that curcumin supplements may reduce levels of inflammatory markers and help treat or reduce symptoms of inflammatory health conditions like inflammatory bowel disease, arthritis, psoriasis, depression, and atherosclerosis. It can also improve antioxidant status. Curcumin and other curcuminoids are powerful antioxidants that may improve your antioxidant status. So antioxidants are going to protect against cellular damage from free radicals associated with health conditions. Those free radicals will be associated with health conditions such as diabetes, heart disease, and cancer. It improves blood vessel function. Studies suggest that curcumin supplements may promote the dilation or widening of blood vessels, increasing blood flow and reducing blood pressure. It reduces heart attack risk. They may also lower the risk of heart attacks, possibly through their anti-inflammatory effect by improving endothelial, that's the cell lining function, or by improving cholesterol levels. It has anti-cancer properties. Curcumin may help slow cancer cell growth and promote cancer cell death. Current research is investigating curcumin's potential as a treatment for a variety of cancers, including breast, prostate, pancreatic, colorectal, and lung cancer. And it supports neurological health. Curcumin supplements may improve symptoms of neurodegenerative diseases, things like Alzheimer's disease, Parkinson's disease, multiple sclerosis, and dementia. Of course, it is a spice, and it's also used as a food dye. People eat it for health benefits as well. It's been extensively studied. Now, the thing is, turmeric also contains 2% oxalate. Oxalate is what ends up being formed to make kidney stones. So at high doses, it may contribute to kidney stones in those who are prone to get kidney stones. And as stated, not all commercial turmeric powders are pure. Some are adulterated. and it may have potential toxins that are not listed on the label. And they may also contain fillers like cassava, starch, or barley, or wheat, or rye flour. And for those who are gluten sensitive or gluten intolerant, along with celiac disease, that would cause adverse effect. Some turmeric powders may also contain questionable food colorants, which are added to improve the color when the powder has been diluted with flour. And one food colorant, which is frequently used in India, is called metanyl yellow or acid yellow 30 thick. And in animal studies, the metanyl yellow may cause cancer and neurologic damage when consumed in high amount. And the thing is, the toxic levels, effects of metanyl yellow have not been investigated in humans. However, it is unlawful to be used in the United States or Europe. Some turmeric powders also may be high in lead, and lead, a heavy metal, is toxic to the nervous system. So, as noted, as already said, turmeric has an anticoagulant effect or a blood thinning effect. So it can interfere with blood clotting. So if you happen to be on an anticoagulant, if you're on warfarin or blood thinner, it may increase their effects. It may lead to excessive bleeding. Turmeric can also lower blood sugar. It may enhance the effects of anti-diabetic drugs or insulin. Turmeric can lower blood pressure, and so it may have additive effects for someone on blood pressure medication. Turmeric can aid digestion by increasing stomach acid levels, but this might have a negative effect for people who are on antacids. It's going to counter your antacid effect. So if you're considering taking a supplement, you should always talk with your doctor. So how much turmeric should you take, or curcumin? Taking doses of around 1,000 milligrams per day did not lead to any apparent adverse effect. The range I've understood also to take would be 750 milligrams to 1.5 grams per day. But for a small proportion of people, they may have mild side effects at higher doses. So I would stick with 1,000 milligrams or less. As stated, that you might have digestive issues, flatulence, in particular, bloating, acid reflux, diarrhea at daily doses above 1,000 milligrams. Also, for people on 400 milligrams or higher, it may cause headache and nausea in a small number of people. Skin rash also has been reported after taking a dose of 8,000 milligrams of curcumin or more, and this seems to be very rare. And also, that's a lot more than what a normal dose would be. Extremely high doses, 1,170 milligrams per pound or 2,600 milligrams per kilogram of body weight daily for 13 weeks for up to 2 years may cause some serious side effects in rats. But hey, we're not rats, but still, better to proceed with caution. So these are the different medications. If you are on them, we suggest you maybe discuss with your doctor. If you're on antibiotics, anticoagulants, antidepressants, antihistamines, cardiovascular medications, or chemotherapeutic agents, all of them, the curcumin may have an effect. There was a study that showed that curcumin may decrease the levels of certain antidepressant and antipsychotic medications. It's been shown to enhance the antidepressant effects of fluoxetine. And for a certain DMARD, an anti-rheumatic drug, sulfasalazine, it may increase its effects when it's used to treat ulcerative colitis or rheumatoid arthritis. Curcumin may inhibit the anti-cancer activities used for chemotherapy, so that would be a problem. Of course, if you're on a blood thinner, and when you take curcumin, especially in high doses, you are risk for excessive bleeding. It may lower blood sugar, as stated, or enhance the effects of an anti-diabetic or insulin. It may lower blood pressure, so they have added effects to your blood pressure medication. And it may increase stomach acid levels, which may inhibit the effectiveness of an antacid. So moving on, another very popular supplement used for pain, particularly joint pain, would be fish oils. Fish oils are omega-3 fatty acids. Two found in supplements are docosahexaenoic acid and eicosapentaenoic acid, and they are known for their anti-inflammatory effect. Clinical research shows that taking fish oil supplements reduces symptoms such as joint pain in those with rheumatoid arthritis. It doesn't seem to reduce osteoarthritis symptoms. I'm not sure about that. I've had people who felt that they had less creaking down on your joints because the cartilage layer over the bones gets eroded with osteoarthritis, wear and tear. And so when you get that creaking in your bones, that's what that is. And I've heard that people with taking fish oil as patients, even though they didn't comment on it reducing pain, but they did comment on it reducing that sensation and that feeling of and that sound of the creaking in their joints. Typical fish oil doses range from 300 to 1,000 milligrams per day. Glucosamine. Glucosamine is a natural component of cartilage, the substance that prevents bones from rubbing against each other and causing pain and inflammation. It might also help prevent the cartilage breakdown that can happen with arthritis. So it's a basic building block of your cartilage. And many supplements aimed at treating joint pain contain glucosamine. It's been most well-studied supplement, one of the most well-studied supplement for osteoarthritis. So there's one study that products containing glucosamine hydrochloride did not improve joint pain caused by osteoarthritis, but another study with glucosamine sulfate, other studies using glucosamine sulfate found that it does improve the symptoms. So the better option is to take glucosamine sulfate and not glucosamine hydrochloride. When taken over a long period of time, glucosamine sulfate may also help to slow down the progression of osteoarthritis. It slows the narrowing of the joint space, which is a marker of the condition getting worse when taken up to 3 years. The typical dose, you must take at least 1,500 milligrams per day. That upsets your stomach, or you find the pill is too large. You could take 3 doses of 500 milligrams per day. And what to say this, you have to take glucosamine at least a month, 2 months before you start to feel relief. Just as it is, it's a building block for your cartilage. It's going to take some time to get incorporated into to creating more cartilage. If you have any cartilage there, chondroitin is also a component of a building block of cartilage. It can also help prevent cartilage breakdown from osteoarthritis. There have been many clinical studies that have found chondroitin can reduce joint pain and stiffness in people with osteoarthritis, and people taking chondroitin stated that they had a 20% or greater improvement in their knee pain. Chondroitin sulfate may also slow down the progression of osteoarthritis when taken for long term. It has been shown in studies to slow the progression of narrowing of the joint space when taken up to 2 years. There's a lot of joint supplements where we'll have chondroitin and glucosamine together. It's not really clear that the combination of both works better than either one separately. But the chondroitin, a typical daily dose will be 400 to 800 milligrams 2 to 3 times per day. Again, you're going to have to take that at least a month or 2 before you know if it's helping you. Now, SAMe, which stands for S-adenosyl L-methionine, is a supplement commonly used to help with symptoms of depression as well as osteoarthritis. Your liver naturally produces SAMe from an amino acid called methionine. It has several functions, including help with the production and repair of cartilage. When taken as a supplement, SAMe can help with symptoms of joint pain caused by osteoarthritis. It may be as effective and as an anti-inflammatory drug such as Celebrex. There was one study where they compared Celebrex to SAMe for a month. In the first month, Celebrex improved the symptoms better than SAMe, but by the second month, the treatments were comparable. If you want to try it, usually take it in doses of 200 to 400 milligrams 3 times per day. Keep in mind that it may take some time to notice its result. Boswellia. Boswellia is known as Indian frankincense and is commonly used for pain caused by arthritis. Chemicals in this extract called Boswellia acids have anti-inflammatory effect. Clinical studies have shown that Boswellia extracts improve pain symptoms more than a placebo in people with osteoarthritis. You want to try Boswellia for joint pain. It's used in ranges from 100 milligrams daily to 333 milligrams 3 times per day. Now this one is new for me. Avocado soybean unsaponifiables. Avocado soybean unsaponifiables, otherwise known as ASUs, It refers to a type of extract from avocado and soybean oils that might help prevent the breakdown of cartilage, and it also may help repair cartilage. Clinical studies show that ASUs improve pain symptoms more than placebo in people with osteoarthritis. Typical dose of ASU will be 300 milligrams per day. Now, MSM, you may have seen this, methyl sulfonylmethane, is another common ingredient in supplements that help with joint pain. In a study, MSM improved pain and functioning compared to placebo in people with osteoarthritis. Typical MSM doses range from 1,500 milligrams to 6,000 milligrams per day, sometimes divided into 2 doses. Now, switching from, say, what we've been talking about, anti-inflammatory supplements, vitamin D is a hormone which is synthesized in our skin with the presence of sunlight. And like other hormones, vitamin D plays a wide range of processes in the body. And here we are showing that vitamin D has a role in pain relief and inflammatory, nociceptive pain and inflammatory pain. Low vitamin D levels have been associated with increased pain and higher opioid doses. And recent interventional studies have shown promising effects of vitamin D supplementation on cancer pain and muscle pain, but only in patients with insufficient levels of vitamin D when starting. So in other words, if your vitamin D level is normal, the vitamin D is not going to make a difference for your pain level. But if you're deficient in vitamin D, and how they measure that is by taking 25-hydroxyvitamin D or 25-OHD, they measure that level in your blood, and if it's less than 30 nanomils per liter, then you would most likely benefit from the supplement. And if you have greater than 50 nanomils per liter, probably will have little benefit from the supplement. All right, so it's a safe, simple, and potentially beneficial way to reduce pain among people with vitamin D deficiency. And to be honest, vitamin D deficiency is very common because many of us just don't get out in the sun like as we should, and particularly those, in climates that get cold and don't have a lot of sunlight. So then the last one, just to mention, I was going to talk about magnesium. I'm not going to really recommend magnesium because from what I could see, there was a Cochrane study. Cochrane will review a bunch of studies and look over all the results of all the different clinical trials. And there wasn't any real conclusion that magnesium helped with spasms. I've been told and thought all this time that magnesium helps. I know there's the different supplements, different types of magnesium supplements. Magnesium glycinate has more bioavailability. I read that it was more likely to be helpful for muscle spasms. But when I read that about the study, I thought, well, I don't want to advise things that don't help, that don't have scientific evidence that they help. So skipping that, but there's also a vitamin which can reduce pain, and that would be vitamin B12. If you have a lack of vitamin B12, rheumatoid arthritis symptoms are worse, including joint pain and stiffness. So vitamin B12 specifically is a vitamin for muscle pain and joint. It also protects the nerves. It stimulates nerve regeneration and could help reduce the pain from old injuries. So it would be worth finding out if you're vitamin B12 deficient. We also know it helps with energy. If you've had a gastric bypass, for obesity, you want to make sure you're getting vitamin B12 supplements because your absorption of vitamin B12 is less limited if you've had that gastric bypass. And that can be very important for your nerves. I've seen someone who became paralyzed because they weren't warned to take vitamin B12, and over a period of time, it affected their nerves drastically. So that's all I have for today. That was pretty long. I don't know if you're still listening, but if you are, thank you for hanging in there. Until next time, peace and blessings.